Today on Being Well, urologist David DiDomenico from Sarah Bush Lincoln Health System is here to talk about overactive bladder. This treatable condition affects men and women and can have an impact on quality of life if left untreated. We'll learn more about what causes OAB and what types of medications and procedures are available to alleviate symptoms. That's all coming up next on this edition of Being Well. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center. HSHS St. Anthony's Memorial Hospital, delivering healthcare close to home. From advanced surgical techniques and testing to convenient care for your family, HSHS St. Anthony's makes a difference each and every day. St. Anthony's, where you come first. Hello, and thanks for joining us for another edition of Being Well. If you're one of those people that you gotta go all the time, well, it may be the signal of something called overactive bladder. And today, to answer our OAB questions, we've got Dr. David DiDomenico, who's a urologist from Sarah Bush Lincoln, to join us.
Thank you.
Thanks for coming on board today.
Well, thanks for having me today.
So, talk a little bit about what a urologist does and kind of the scope of what you take care of.
Sure. So a urologist is basically a doctor that we're basically from the two branches of medicine. There's a medicine branch and there's a surgery branch. We come from the surgery branch, from general surgery basically. But we deal with the plumbing basically, the kidneys, your bladder, and anything in between of kind of. So a lot of the times when people see urologists, we see both, I should say, both males and females. Half of my patients are males, half are females. We see a lot of older patients, but we also see middle-aged patients, and we see young patients too. We do circumcisions and things like that, and sometimes when males' testicles are descended, we bring those down too. So basically, from the kidneys to the bladder, that's a urologist, and we come from the surgical end. As opposed to the medicine side would be a nephrologist, someone who, when you're on dialysis, you see to maintain your kidney function.
So you get to take care of all those problems that we as patients are horribly embarrassed to admit.
Sometimes that's the case, yes.
And I know you've said in a previous visit we had, you say you laugh a lot in your practice because
Absolutely.
You have to.
It's a lot of fun. The patients, it's serious if people come to you with something they want help with, but they also understand that not a lot of things we do, some things are quite funny, and so that's the fun part of urology. We do laugh.
Well, we don't want to make light of some of these things, but in some cases you just have to get through it. So we're talking about overactive bladder. Are you seeing a lot of people with it? Do a lot of people have it?
Yes, I think it's estimated in this country 26 million to 30 million people have overactive bladder symptoms. And kind of what overactive bladder is basically if someone's voiding maybe 8 or 9 times or more a day, meaning going to the bathroom, the frequency, that can be associated sometimes with leakage of urine, which we call incontinence. It doesn't have to be associated with that. Sometimes it's associated with what we call nocturia, getting up at night to urinate. More than 2 times, oftentimes we consider possibly abnormal. And that's important, especially in the elderly population. If they're getting up at night, they can also get hurt, break a hip, and that's a serious issue for them.
So what's actually causing the bladder to be overactive in the first place?
Sometimes we know and sometimes we don't know. But the bottom line is, what I always tell patients, the brain controls the bladder. And so when a normal person gets an urge to urinate, you kind of get that warning time. You know that your bladder signals you maybe time to look for a restroom. Overactive bladder, we kind of lose that control. That warning time gets very shortened if you have it at all. And so any disease that can affect the brain or the bladder can result in these overactive bladder symptoms.
Okay. So are there any other conditions out there that can contribute to OAB or that can mimic OAB and it might be something else?
There are many conditions that can. And so one of the things when you have a urinary problem like this, one of the best stops is your primary care provider, and to get that once over checked to make sure everything's okay. And one of the things is sometimes people have issues with Parkinson's disease or multiple sclerosis. These are all things that can affect the brain and can give you these same type of urinary symptoms. When someone comes to see me, one of the first things we do, we'll have several questions and try to pinpoint when are you leaking urine, when are you having frequency, when are you getting up at night. And then from there, we'll go ahead and check a urinalysis. So urinalysis is our basic test. We're going to look for things like blood in urine. Do you have blood in the urine? Do you have sugar in your urine? Do you have diabetes, which can give you this frequency and urgency? So those are some things we look for.
So you had said that sometimes is it older patients that get OAB, or is there a certain population that is more susceptible to it?
Sure. You know, anybody can get it, basically, but we tend to see more in elderly people. Just because you're getting older, you don't have to have this. It's not a process of getting older, but it does occur frequently in that age population.
What about for women who have had children, several children? Are they more susceptible to it?
Not that we know of.
Childbirth?
Not that
Okay.
we know of. That shouldn't have any impact on that. Yeah.
All right. So typically, if you go in for your regular physical, it's not really something, if memory serves me right, it's not something that the doctor really asks about. How many times a day are you urinating? So should you just bring it up if they don't? How do you start that
Sure.
that talk?
I think it's where you start off. If you start with your primary care provider, those poor doctors are overwhelmed. They're taking care of from head to toe, and they consult a lot with the heart and the lungs, things like that. And if they have time, they'll ask. Oftentimes they don't have times. Some doctors in primary care have screening forms, and you'll answer ahead of time. They'll kind of pinpoint, oh, do you have a problem with urination and things like that. When someone comes to see a urologist, typically this is what we do. We're not focused on your heart and lungs, and so we'll ask you a series of questions about how you urinate, when you urinate, do you move your bowels okay? And for a male, do you have good erection? So we'll ask a battery of questions. And oftentimes with that, we'll identify many things. And then when they come through the door, oftentimes that's we call our chief complaint, what they're complaining about, what they want fixed. And so they'll tell us off the bat, it's like, I can't make it here to Champaign without stopping 10 times. And so they'll tell us.
So do you think, are there people that live with it that think, oh, this is just normal, I'm just getting older, and then all of a sudden the light goes on, it's like, no, that's not normal?
Yeah, there are, unfortunately. And the big difference from now, the way it used to be, is years ago, people didn't talk about anything with urination. They was too embarrassed. They would just leak in silence and kind of run off to another room. And some people wouldn't go out because the feel of the odor of urine and things like that. Nowadays, people, because of so much information on TV, are happy, and the medications are happy to talk about some of the stuff. But still, some older people may still have the concept that it's just part of getting old. You're supposed to do this, and it's really not. So there's a lot that can be done oftentimes.
So you said going to the bathroom 8 or 9 times a day that's overactive. What is sort of a normal baseline? If you drink a reasonable amount of fluid in the day, what's normal?
Sure. The standard definition is usually over 8 voids a day. Then you start to think about overactive bladder.
Okay.
But what's normal to drink? Normally everybody's kind of different. And so, water is an important thing to drink. A lot of people don't drink water. They'll drink anything else but. And so our body is made of 65% of water, 70%. And so it's an important thing. So we probably all should drink more water, especially when it's hot like it is now, to prevent kidney stones and things like that.
Right.
So what's good? I mean, it's hard to say because some people are older and they can't take that much water. They're fluid restricted. But in general, your body kind of tells you what you need to take. And if you're drinking a large glass of water, like 6-8 ounces glass of water, 2 or 3 a day, it's a good thing. I mean, some people don't even do that.
Yeah.
But
and that water is what keeps flushing everything
it keeps
out.
everything in your body going. I mean, your body needs hydration. Yeah.
So if someone has OAB and it's left untreated, can it lead to other things down the road?
Great question. Oftentimes, if it's strictly overactive bladder, there's nothing else going on, no other diseases, the answer would be no.
Okay.
This is what I call a quality of life issue.
Okay.
This is something, as I tell patients, if it bothers you, it bothers me. If it doesn't bother you, it doesn't bother me. Some people are around the house, they don't go out too much, and it's not a big problem. But for a lot of people, if you're the type of person who would love to go outside but won't go outside because it's a problem, and that's what we need to treat. And like I said, there are a lot of wonderful ways to treat this stuff.
Well, and certainly there are a lot of people that have it because, as you said, you watch TV during the day or at supper time. There are lots of ads for the medications, for undergarments and things like that. So it is becoming more mainstream. and people are talking about it, and it's not this embarrassing thing anymore.
Yeah, absolutely. I always joke with my kids, the news hour is like the urology infomercial time, overactive bladder, erectile dysfunction. So yeah, it's a lot of information.
So let's run us through the process. If I come into your office and I say, Dr. DiDomenico, I think I have overactive bladder, what's kind of the run through of what you do? You kind of
Sure.
talked about some of it before,
Sure.
but let's run through it.
So there's two ways you can get to me. One is you can see your primary care doctor, and they can say, yes, you'd be good to see a urologist, and that's one way. So you can always see your primary care and be evaluated that way. The other way is you come directly to me. You can come and say, if you've got urinary problems, come to the office. Oftentimes you'll contact the office, and there's a standard forms that we'll give you to fill out. Some of these forms we give ahead of you, so you don't have to sit in the office and fill them out there. You could fill them out at home. And those questionnaires will help identify certain things. We'll also collect a urine specimen. We just urinate in a cup, and we'll look for the presence of blood and for other things, bacteria, make sure you're not infected. We'll also check, sometimes it's called a post-void residual. We'll make sure you empty your bladder after you urinate. We'll scan a little wand, ultrasound wand of your bladder, make sure you empty it out completely. Some people think they're emptying out their bladder when they're truly not emptying out all the way. So that's another thing we do. And then a physical examination. I'll examine you, your abdomen, and if it's a female, a pelvic exam. If it's a male, it's also a pelvic exam. We'll check the prostate, things like that.
So do you do any sort of ultrasounds, anything else than that? Or that wand thing is the ultrasound?
That is the ultrasound. It's a bladder scan, so that's a form
Okay.
of ultrasound. So we'll check to see how well the bladder's emptying.
Okay, so if you decide that, yes, Lori Banks, you have overactive bladder, what's next?
So at that point, then we'll talk about how this impacts your life, what part of your life is being bothered by this. I'll look at your diet. We'll talk about, so what are you eating and drinking? Well, yeah, you might be one of these people that are having a pot of coffee before you go to bed, and that's why you're up all night. It happens, believe it. So then we'll try to modify the things. Another culprit is the soda pops or the carbonated beverages. People like those. And those are stimulants to the bladder, and they can make you void more frequently. Sometimes just eliminating these things, you're better.
Yeah.
So that's the first thing. And after we do that, then there's also the medications that we have now, these overactive bladder medications that you see on TV all the time.
Yeah, with the little, there's one with the little animated the bladder is a character, which I guess it's kind of a good way to sell the medication. It's kind of actually a cute little thing. But so how do those medications work? What do they do?
There's two basic classes of the oral medications. The first class is what we call an anticholinergic, and basically their properties are to control the smooth muscle of the bladder. The bladder is a muscle. And I like to tell people the bladder has two functions. One is storage of urine, and the other is elimination. So you have to have both those functions. So it kind of stabilizes the bladder, gives you a little more of that warning time. The drawbacks to the medicine, or the side effects, are dryness of mouth, constipation, sometimes blurred vision. And in some elderly people, with some of the older medications, they can be confused. So sometimes you've got to be careful on which ones you choose.
Okay.
There is another oral medication that's newer called Mobetric, a different class of medication that doesn't have some of these dryness of mouth, these anticholinergic side effects, and that's been a great new drug in the past couple years.
All right. So there is also some minor surgical options.
Sure.
When does someone go from maybe a medication option to the next thing that we're going to talk about?
The dietary changes are easy, but sometimes hard to enforce. We do that, then we go to the medication. Medications, unfortunately, maybe only 60% of people initially stay on, but they drop off quite quickly. Maybe because it's a quality of life issue, and sometimes they forget to take their medications because sometimes you've got to take it, and just sometimes the cost of the medications can be expensive, and so they may drop off. But there are other things that we can do now besides the medications. If they progress, if the medications don't work, or if they're not compliant with the medications, there are basically two more, they're surgical things, minor surgical things that we can do to help their bladder. One that we talked, I think briefly about, was a medicine, was a form of treatment called neuromodulation. This is basically, as we talked about, the brain controls the bladder. This is a way of interrupting that pathway. And there are two ways to do it. You can come to the office once a week for 12 weeks, and for half an hour you can read a book, and we'll put like a little needle, like an acupuncture needle in your ankle, and this stimulates the nerves from your bladder, from your nerve in your foot, your posterior tibial nerve, to your bladder.
Really?
And that'll do that. There's another form of that called InterStem. His nickname is a pacemaker of the bladder. It's a little battery that we place into the buttocks. This is all done outpatient for this. And the nice thing about this method is we have a lot more control over the bladder. This method also works well people who suffer from fecal incontinence. If they're losing stool, it can help those patients. So with the InterStem, basically you'll have remote control. Everything's inside. You don't have to visit a doctor once a week for 12 weeks. You go live your life, and then they'll come in periodically and we'll check the program just as someone with a pacemaker in their heart has, and we can make adjustments, and they can turn it on, turn off. So when they're having good days or bad days, they can actually help do that. There's one more thing that's a medicine treatment that is it's a minor surgical treatment, but it's an office treatment with cystoscopy. That's where you look in the bladder with a scope. Botox. That's not just for your wrinkles in your face anymore. We use it in the bladder. And so we can inject Botox in the bladder, and that's basically a paralyzing agent, and that'll help break some of the symptoms of frequency.
So what does Botox, it's not just, it's for your bladder as well.
They put it everywhere nowadays.
What does it, I mean, we know what it does for the face, but what is it doing in the bladder? That's interesting.
So again, as I mentioned, the bladder is a muscle. And what Botox is, it's a paralyzing agent from the botulism, basically, and so it's a paralyzing agent. So it basically kind of paralyzes the muscle. So in low doses, it can help give that relaxant to the bladder, and so that's
the bladder isn't. So when your bladder is emptying, it's constricting. The muscle is.
Think of your bladder like a balloon. So you've got a balloon here, and it's empty. There's no urine, no air in it, and it's completely collapsed. That's the same thing like your bladder. You fill it with air, that balloon expands. That's your bladder. And the difference with the bladder, when you have to urinate, you squeeze, and it's the muscle that will squeeze. But sometimes you can get spasms, and the bladder will shake, and you'll leak, or get wrong signals. And
that's the OAB happening.
That can be that component.
So what does the neuromodulation do when you're hitting that nerve in your ankle? Is it just sending a signal to your brain?
Basically, it goes down to the pelvis nerves over there, and there's what we call sacral nerves there, and so it's interrupting those nerves that go to the brain. Nobody knows exactly why it works. There's a lot of theories, but the bottom line is we're interrupting that pathway, and they first started this in the 1970s in San Francisco for spinal cord injury patients, looking to try to get those patients to urinate again. And it wasn't so successful in that, but they found out that it was helping other people with other bladder issues. And it's kind of been transformed over the years and become quite popular.
So the pacemaker version, is it doing kind of the same thing?
Yeah, it's doing it, but it's actually, as opposed to the posterior tibial nerve, it's a much more effective form of neuromodulation, because that wire is sitting right with the nerves that you want to be stimulated. And the other advantage of that is, as I mentioned, with this remote control device, that once it's on, but you can set it many different pathways, and you could, and which you can't do with the office procedure, which kind of works for a while, kind of trains the bladder, and then you're kind of off on your own, and then you come back later for boosters and things like that.
That's what I was going to say. I'm guessing too, with the Botox version, you have to go in and
re-inject it. The downside to Botox is whether it works or doesn't work, you live with it for 6 to 9 months. So one of the drawbacks of Botox is 8% of people may not be able to urinate, urinary retention. So one of the things we tell people is, if you don't urinate, you're going to have to use a catheter. We can teach you how to catheterize yourself, or you can wear a catheter. People don't like that too much. But that's one of the drawbacks of it. But it has helped a lot of people. Neuromodulation, InterStem, these are things that really have helped a lot of people.
Which, is there one that you're doing more of, that you're seeing better success with in your practice?
I see a lot of everything, basically. And when patients come in, we don't jump to neuromodulations or to Botox. We start with the medications, start with the dietary stuff first, and usually we jump right to the medications, because the dietary stuff we've kind of get a handle on very early on. But it's the medication, and sometimes we try one or different pills. Some of the pills are very effective, and so sometimes some of the problems with the pills may be the side effects. So if you have dryness of mouth or constipation, but the medicine's working, we'll switch you to another medicine to see if we can get rid of those side effects.
How long does it take, like if you're on the medication, for it for you to notice a difference? Is it instant? Does it take a couple of weeks?
Depends. For some people, they realize very quickly, maybe that first week. But with the medications, it may take 2 or 3 weeks, maybe 4 weeks to really know if it's really working well for you. But oftentimes that first week or two, we have a good idea whether it's working.
So you said, like, neuromodulation, it takes a little while for your brain, for it to get trained. Does that take a few weeks for that to?
That usually works quite quickly. The other thing that we use this neuromodulation, the InterStem, for, as I mentioned, we can use it for the frequency and urgency, these overactive bladder symptoms. We also use it for people who cannot void. They lost their ability to urinate, and that's the only thing that we have. There's no medicine I can give you to make you urinate. But with this electrical stimulus, we can sometimes get some people out of retention, and they'll urinate again. And I've had people as young as 17 years of age all the way to like 97 years of age put this in. So it's not just, you can use it in many different people. And so it's pretty amazing when someone's 90 years old and they thought that they'd be stuck with a catheter, that they can urinate again. So it's pretty impressive. It changes their life.
So there's a lot of new things out there that you can try. And I just wanted to ask a couple general questions
Absolutely.
here. Someone had asked me this: am I going to get overactive bladder if I hold it all day? Like if you remember, your mom always said, "Now don't." My mother always said, "Now go to the bathroom when you have to.
Sure.
Holding it is bad." Well, is holding it bad for you?
You should, when you need to urinate,
go.
you should go. I mean, if you're going every 5 minutes, that's a problem too. But you need to go, and for a variety of reasons. Because by holding it, you can, as we talked about earlier, the bladder's a muscle. You can destroy your muscle.
Yeah.
And if you destroy your muscle, you lose the ability to eliminate and squeeze out.
Mm-hmm.
And you don't want to be one of those people that have to wear a catheter, use a catheter
Right.
all the time. If you do, you do, but hopefully you can avoid that.
So will holding it, years of doing that, does that contribute to OAB or not?
OAB, no one really knows the
Okay.
answer to that, but it's just not a good thing. You just like everything else, you don't want to overuse anything, so
Right.
you want to be able to empty. And also for little girls, sometimes we see them, they have urinary tract infections because they're not urinating, they're too busy playing, they won't stop to urinate.
Yes.
Sometimes that can be cause of urinary tract infections, so urinating is good.
Yeah.
Drinking water is good.
Urinating is good. That's the word of the day, or the phrase of the day. I was going to ask one more question. Any other urinary tract health tips that you would like to provide for us to keep things
Sure.
moving and going?
Sure.
Is cranberry juice good for us?
Cranberry juice is actually, there is some scientific evidence that good to prevent infections
Okay.
in females. It says helps prevent, there's a bacteria called E. coli, which is the most common type, and that there are little, what they call pili, the way they grab onto things, and that will help reduce the rates of infection. But also hydration, drinking plenty of water reduces, keeps things flowing. So if the tip of the day, if I could leave you, is in general, what's good for you? A heart-healthy diet, as we always say, low fat, high fiber, plenty of water. These things, and exercise your body, exercise your brain. It's kind of like I learned early in biology, use it or lose it, and that kind of goes with everything, every field. And as a population in the United States, we're a little overweight, we're a little sedentary. These are things that create a lot of problems. If we lose some of the weight, become more active, we lose a lot of our problems, including our bladder problems. So
That's what I was going to ask. Do people who carry a lot of extra weight in their middle have more issues with
they
their
tend
bladder
to,
because there's
they
that
tend
weight
to.
pushing on
Especially with the incontinence. I'll see a lot of females with the stress incontinence that we talked about earlier, coughing and sneezing when they leak urine. If they lose weight, study shows some of their incontinence goes away. So yeah, losing weight and makes a difference.
All right,
for a lot
I
of us.
remembered what my last question is. Is OAB genetic? Does it have any genetic
We don't know.
predisposition?
We don't know
Okay.
if it's truly genetic. We know it exists. We know there's it's kind of multifactorial. Many things can factor into it. But could it run a factor? Sure. Run a family? Sure, it could. We find a lot of things do run a factor. We just don't know, is it on gene number 9 or something? We don't know about that. Maybe later on we'll find out.
Yeah. Well, I think the important thing to come away with today is that this is a quality of life issue that is sounds like there's some really fairly easy treatments available that can really make a difference for people.
There's a lot more now than there was 10, 15, 20 years ago. So it's really,
and it will probably continue
it's
to
going
get
to continue to
better.
get better.
Yeah.
Yeah.
Dr. DiDomenico, thank you so much for coming on the show. And,
Thanks, Lori. Thanks for
and
having me.
shedding some light on overactive bladder for us.
Well, thank you.
Thanks.
All right.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Dr. Ruben Boyajian, located at 904 Medical Park Drive in Effingham, specializing in breast care, surgical oncology, as well as general and laparoscopic surgery. More information online or at 347-2255. Rediscover Paris. Our patient care and investments in medical technology show our ongoing commitment to the communities of East Central Illinois. Paris Community Hospital Family Medical Center. HSHS St. Anthony's Memorial Hospital, delivering healthcare close to home. From advanced surgical techniques and testing to convenient care for your family, HSHS St. Anthony's makes a difference each and every day. St. Anthony's, where you come first.